this morning. And we're joined by our panel, Betsy, McCaughey, and also Nick Tate joining me right now on the set. Nick, I wanted to ask you, Politico has an article on a new Gallup poll showing really a majority of Americans have pretty good reviews of the Affordable Care Act. 71% saying the coverage they got through the exchanges was good or excellent. What is your thought about that particular sampling?
That's almost exactly the percentage of Americans who've gotten subsidies from the federal government to help them pay for their insurance. So of course they're going to be happy. This is why the issue for the Republicans is very complicated. If in fact there's wholesale repeal, if the Supreme Court strikes down these subsidies that 5.5 million Americans are now getting and more are expected to get in the future, who are voters going to blame? They're going to blame the Republicans. That's why I think there needs to be an approach that preserves some of the things in Obamacare that people seem to like, allowing parents to keep their kids on their insurance to age 26, some form of the subsidies, we need to figure out how to pay for them, and some of the things that people really like, at the same time getting rid of the more onerous components, the employer mandate, which kicks in January 1, some of the taxes, the medical device manufacturing taxes 1, and major reforms to Medicaid that don't bankrupt the country or the states. I think that's where the next wave in the narrative on Obamacare goes, and the next focus for debate and legislation.
Betsy, flawed poll, or do you admit that there are some people that are benefiting from the Affordable Care Act?
Well, clearly people who are getting a big health plan for free are benefiting. And as Nick pointed out, not only are these people getting subsidies, but let's be clear how big a subsidy. The fact is that the average person getting a subsidy is only paying 1/4 of the price of their health plan. So, of course, they are happy with it. But that's a small number of Americans, about 5 million people, compared with 318 million people in this country, most of whom are suffering adverse effects. They're losing job security. They're losing their full-time job status. Medicare people are seeing their care really cut. Nurses spread thinner. And as for the one-liner in this law, which was added at the last minute, allowing children to stay on their parents' plans till they're 26, that is just a one-liner. We can add that to any bill passed through Congress. Right. Nobody should tolerate the 2,572-page Obamacare disaster just for that one line.
I want to talk a little bit to Nick about skyrocketing costs. And in particular, a lot of people try to offset those skyrocketing costs with generic drugs. Where are we at right now as far as the cost of those generic drugs?
Well, for years we've been told that generic drugs is the way to go. It saves money. They're medically, chemically identical to brand name drugs. But in fact, over the last year, a new report out this week in the New England Journal of Medicine finds that about 10% of generics have doubled in price over the last year. Some of that has to do with market forces. There are fewer manufacturers, but some of it also has to do with questions about the safety of generic drugs. There are new reports out this year that find that, as you can see here, the numbers of increases for some of the drugs, antibiotics, antidepressants, have gone up by thousands of % in a very short period of time. Some of the reasons for this have to do with the fact that many of the generics we get are imported from other countries overseas, and there are problems with safety. The FDA earlier this year banned imports from 3 major manufacturers in India because of recalls and generic drug safety. So where we are today is, one of the financial benefits of generics is really being taken away by the fact that they're going up in price. And for many consumers, the question is, are you really getting even what you're paying for? Many of these drugs are either not containing the ingredients they're supposed to, they're not effective, and in some cases they may actually do some harm. So, there's some new questions now about generics that consumers really need to discuss with their doctors. A brand name drug may be a better option depending on what you're taking.
Betsy, you obviously are an expert in the public health realm. Tell us about your concerns with generic drugs.
Well, Nick has put his finger, as usual, on a very important issue. Caveat emptor, some of these generics are not actually equivalent to brand name drugs, and that's particularly true in the area of psychiatric drugs. But let me point out, in addition, that although half of generic drugs have gone up in price, half have also declined in price. Overall, it's kind of a wash. That's not very reassuring or very helpful to the person who's seen his particular drug go up 1,000% in some cases. But we should be aware that the overall market hasn't changed that much. There are a lot of fluctuations up and down. And Nick is also correct that it's due largely to supply. For example, tetracycline, a very common antibiotic, used to be produced by many manufacturers, and now it's only produced by one. So there are shortages of that. I want to also point out that the Obama health law isn't making this and also with a restricted.
Betsy, I'm going to jump in real quick.
Drugs.
Appreciate those comments. We're going to have to leave it right there. We're coming right back on America's Forum.